Bunch of casualties, no apparent reason for their trauma. Think WMD, okay? Unusual sprays, liquids, etc. Dead animals, big clue, something bad, okay? The bad guy just discarded their PPE on their way out of Dodge, okay? You all know this, approach the scene upwind and upgrade. That's not something that I think many third service EMS agencies think about, okay? I don't think they think about the wind direction. They don't ask about it, okay? Just go running into the scene, okay? Do a scene assessment from a safe distance. Alert everybody who's coming after you that you're worried. Let them know what the PPE needs are. And then think about secondary devices. Anytime there is an explosion of any type, assume it was intentional. Think about a secondary device, okay? Because if there's one, there could be two. Number two's waiting for you. What city in the United States has the dubious distinction of being the first city in the United States to have a secondary device planted? I'm sorry? Boston had multiple devices. It was not the first city where that happened. Atlanta had multiple devices. It too was not the first city that happened. Denver, Colorado, 1978, 1 block from Denver Health. Guy planted a bomb outside a VFW post, 2 in the morning. He accidentally detonated it, killed himself in the process, which is no big deal, okay? Police, fire, and EMS all dispatched to that scene. Nothing to do except pick up the pieces, okay? Police officer at that scene, after 30 minutes, was quite bored with the scene, decided he was gonna go buy a Rocky Mountain News in the good old days. Put his quarter in the kiosk, opened up the kiosk, in there was the second device. The timer had failed. Timed for 20 minutes after the first one, okay? Clearly intended for the responders, okay? Think secondary device. Somebody needs to be looking for that. Any explosion, I think that needs to be foremost in your brain, okay? Bad guy might still be there. You know, maybe he set off an explosion and now he's waiting there with a rifle, an assault rifle, okay? You know, the cops want you to preserve crime scene integrity, but deal with what you have to deal with. Avoid the obvious bad stuff, get the extra stuff you need. Radiation, how do you detect it? Well, you can't smell it, you can't taste it, you can't feel it, etc. Okay? So you got to think about it being there, okay? And look for it. Oxygen deficient atmospheres, you guys are familiar with this, I won't belabor that. Chemical compounds that cause pulmonary edema, most notably, which one? Phosgene, okay? Obviously, choose the right respirator for the chemical that you're dealing with, okay? Some chemicals will degrade your PPE, particularly the corrosives. Think about that, okay? And then what other chemicals are at the site that could pose a hazard to you? Biologic agents. You can't see them, you can't taste them, you can't feel them, okay? You don't get sick right away. You have an incubation period, okay? So, look for the powder. Look for the stuff that's being dispersed, okay? Probably don't need to say much for that one. Let's talk about decon quickly. You guys are the experts in decon. I'm not going to teach you how to do decon. I am going to ask this question. You're doing decon. What do you do about the runoff? The book answer is to corral it, okay? All right, let's talk reality, okay? The reality is you have a good incident, good WMD incident. They don't make a container big enough for you to corral all of the water that you should be using to decon people, okay? For years, the EPA was telling hospitals, if you decon patients, you have to somehow contain all the water that you use to decon patients. We said, this is really stupid, okay? And that's why. And after finally about 10 years of arguing with them, they finally agreed that on a good incident, there is no container big enough to contain decon. Let it run into the sewer system, okay? That's my suggestion, is don't waste your time trying to contain it. If it's one victim that you're doing, sure, stick a pool under him, okay? But if you're doing a good incident, Don't even think about wasting your time trying to contain the runoff. Let it go in the sewer. If it really bothers you doing that, run an extra hose down into the sewer and dilute more. But if you think about deconning a patient, okay, you're already diluting whatever it is significantly, okay? It's not a threat anymore. Let it go into the sewer, okay? Detection of all this bad stuff, we said, for the most part, signs and symptoms the victims are having. There are detectors and monitors out there that you can purchase. You can spend a lot of money doing this stuff, okay? And we'll talk about some of them, okay? Chemical agents, clinical signs and symptoms. Recognize the presentation of the victims. There are all these other technologies that are available to try and detect chemicals, okay? These are pictures of some of them. The bad news is all of them have limited ranges. All of them have limited substances they can detect. All of them require that you be in level A protection and go into the scene to get the sample, okay? So, clinical recognition of the signs and symptoms, okay? Biologic agents, once again, nothing easy about identifying biologic agents, okay? So, if you see the powder, great. If not, you know, you're not going to know what's happening. If you do see the powder, there are ways to analyze these things, standard hospital laboratory techniques, etc. These all take time. 24 to 48 hours, optimistically, often longer than that, okay? So if somebody's sick, treat them based on that. Is there sampling equipment out there for the powders and stuff? Yeah, there is, okay? You got to be protected. It requires very rigid adherence to the proper method of sampling these things. Okay, so typically, unless you have the civil support team available to you, you know, we're not going to get an answer right away. Colorado, of course, does have a civil support team out at Buckley, and if they're not otherwise deployed, you can request them to come to a scene. They will come, they will do an analysis for you. Okay. Radiation detection. We said the Geiger counter, that's the optimal way to detect radiation in terms of exposure and contamination. Each of you, if you respond to an incident with a radioactive event, ought to have a dosimeter. Lots of different dosimeters available, so you know, pick one to use. The Geiger counter, you got to have the probe and all that good stuff to do it. It detects alpha, beta, and gamma. You need a special probe for the alpha detector, but beta and gamma are the ones that are most penetrating, so that's what you're worried about the most anyway. So it's a good tool to use. Contaminated remains, for the most part, leave them where they are. Remember, they're contaminated, they're going to need decon, they're not a priority for you. Okay. Obviously, storage of the bodies is a problem. Your coroner is going to want to get involved, etc. So that's a big problem. So a couple of very quick case scenarios. Here's case one. Over 6 hours, EMS is called for multiple patients who are presenting with the same complaints: high fever, cough, shortness of breath, and feeling like garbage. Okay. They were previously healthy. 5 of these people require intubation and mechanical ventilation because of respiratory distress and failure. Most of these people knew each other because they worked together. Nobody at home is sick. So what do you think the causative agent might be? Gross category first: chemical, biologic, or radiologic? Bio. Anybody want to go for chem? Anybody want to go for rad? Okay, so we're good on bio. Okay, so if it's a bio agent, okay, we got respiratory symptoms. What would your considerations be for agents? Oh, come on, it wasn't that long ago. Plague, absolutely, got to be on the list. What else? Botulism usually doesn't cause respiratory symptoms like fever and cough, not till later. So wouldn't be high on my list. Which other one? What? Anthrax, Absolutely. The two biggies that cause respiratory symptoms are plague and anthrax. Okay? What common factors might relate the patients to each other? Well, we already told you. They work together. Okay? Which would make me worry that something at work. Maybe this was intentional. Good chance it was intentional. So, when did this exposure happen? When? That's when they started calling saying they were sick. Yeah, in all likelihood, anywhere between 1 and 3, 1 and 4 days prior to getting sick. Okay, plague and anthrax have an incubation period that's measured in days. Okay, they're not going to get sick right away from a biologic. They get sick after several days. Okay, so in all likelihood, this happened 2 or 3 or 4 days ago. Okay, so if you do decide, yeah, this is probably a biologic attack. Okay, who should you call? CDC, they'd be one group on my list. They probably wouldn't be my first call. That one would be to call the hospitals. Tell them what you're suspecting, because there's patients who could have been sick who showed up on their own. Okay? So they need to know. Who else do you want to think about calling? Families probably already know that they're at least in the hospital.